Okay, this is critical thinking and an introduction to the nursing process. Chapter 2 in your F.A. Davis book. This shouldn't be too long of a lecture. We're going to start off with what is critical thinking. So critical thinking is an important aspect. It's the process of identifying and checking our assumptions. And this is also an important part of the research process. Critical thinkers are flexible, non-judgmental. They need to be inquisitive, honest, and interested in seeking the truth. They possess intellectual skills that allow them to use their curiosity to their advantage, and they have critical attitudes that motivate them to use those skills responsibly. Critical thinking is asking the person next to you, right? This is not, critical thinking is not asking the person next to you, what do you think? Or do you know what that is? Or do you know why that's being given, right? It's you saying to yourself, I'm not sure what it is, and how can I research to figure out the truth, learning and applying it. So the most concrete definition of critical thinking is, and it's purposeful analytical thinking that results in your decision. So some critical thinking skills, right? We want to make sure that we're objectively gathering information on a problem or an issue. So if we're talking about managing patient care, areas that we can objectively gather data would be nursing journals. You might want to be reading some policy and procedures at your organization. You might need to call a pharmacist. We want to recognize the need for more information, right? So we need to be honest with ourselves and not always just, well, I think I know it, so let's go with it, right? We need to honestly say, no, I'm not quite sure. I need to investigate more. We want to make sure that we're using credible sources of information. So Dr. Google is not best. You want to look for your scholarly articles, things that are peer reviewed. Recognizing the need for information is kind of the same as recognizing gaps in one's own knowledge. But don't presume that because it's a gap in your knowledge that maybe your co-nurse or your charge nurse is going to have the knowledge. So just be cautious of that. We want to listen carefully. We want to read thoughtfully. We want to separate relevant data from irrelevant data. Also important data from unimportant data. And we want to make sure that we're organizing and grouping the information in meaningful ways. We want to make inferences about the meaning of the information. We want to visualize potential solutions to a problem. We want to explore advantages and disadvantages and consequences of the potential action. We want to evaluate the credibility and usefulness of the source of information we're getting. We want to recognize differences and similarities among things and situations. And we want to make sure that we're prioritizing and ranking the data as needed. Some critical thinking attitudes that you're going to need, starting with intellectual autonomy. Critical thinkers do not believe everything they are told. They do not just go along with the crowd. They listen to maybe what others think and they learn from new ideas. They do not accept or reject an idea because they don't understand it. Nurses should challenge actions and policies with little logical support. And this doesn't mean that every action and every policy you're going to go out there and challenge. You just need to make sure that you're doing it in a if there's little logic support behind it. Intellectual curiosity. So critical thinkers love to learn new things. They show an attitude of curiosity and inquire and frequently think or ask, what if, or how could we do this differently, or how does this work, or why did it happen, right? And A lot of times, the more you're in the field, the more experiences you'll have to draw on, so the easier it gets. Intellectual humility, critical thinkers are aware that they do not know everything, and they do not feel embarrassed to ask for help when they do not know. They are not too proud to seek the wisdom of mentors with knowledge, skill, and ability. They reevaluate their conclusions or action in light of new information and are willing to admit when they are wrong. They need to have intellectual empathy, right? So empathy is understanding the feeling and perception of others and trying to see the situation as the patient does. So a lot of times they'll say empathy is putting, your feet in their shoes. Intellectual courage, critical thinkers consider and examine their own values and beliefs, as well as are willing to rethink and even reject previous held beliefs that are not well justified. Without intellectual courage, people become resistant to change. We have intellectual preservation, right? So critical thinkers don't jump to conclusions or settle for a quick, obvious answer. Important questions are usually complex, and critical thinkers give them serious thought and research, even when this takes a great deal of effort and time. They use fair-mindedness to make impartial judgments. With that, they treat all viewpoints fairly, realizing that personal biases, customs, and social pressures can influence their thinking. They examine their own biases each time they make a decision. They use intellectual integrity, holding themselves to a high standard of thinking, and to practice these same standards to everyone equally. They always admit to any inconsistencies in their thoughts and their actions. And they use confidence in reasoning. They rely on their critical thinking process and have confidence in their own reasoning. And all of you are going to be expected to be amazing critical thinkers. So it's really good to know all of this so that you can apply it into your future nursing education as well as your careers. So what are the complexities of this thinking process, right? So we have a combination of critical thinking skills and attitudes. And this is a list of processes most commonly used in nursing. So we have problem solving, right, which we talked about in chapter 1, which is going to be identifying a problem and finding a reasonable solution to it. Problem solving is going to require critical thinking skills such as organizing data, identifying relevant and important data, making inferences and decisions, projecting consequences of actions, and applying theoretical knowledge to specific patient contexts. Then we have decision-making. So decision-making is choosing the best action to take. In nursing, this would usually be the action likely to produce the desired patient outcome. And when we get into our nursing process, we're going to talk more about our plannings and all of that stuff. But this requires thinking skills such as making clinical judgments, making clinical choices, and the importance in problem solving. And then we go on to clinical reasoning. So this is reflective, concurrent, creative thinking about the patients and the patient care. Reasoning is logical thinking that links thought together to create meaning. And then clinical judgment. Nurses use clinical reasoning in the nursing process and with their clinical judgment, which interprets thinking about the patient's needs or concern. Clinical judgment enables nurses to adjust interventions and care based on the patient's response to previous care. It requires that clinical reasoning to make clinical judgments, and it utilizes decision-making after evaluating the effect of the previous decision made. So all of those get linked together in our complex thinking process. So why is it important to have critical thinking, right? Critical thinking is going to help nurses as they face their many complex situations. Each patient is unique, and we have to be critical thinkers to make sure that we're caring for them in the most optimal, compassionate way. We want to give them good patient outcomes and quality care, and you need that critical thinking to be able to do that. Nurses apply this for their discipline. Nurses use knowledge from other fields to help them. So it's good to be able to critically think in that regard. Nursing is fast paced. There is a scientific basis for patients' care changes constantly, and critical thinking is always linked to evidence-based process. And we as nurses always want to use the most up-to-date evidence-based practice. So one critical thinking model is the 5-step category process. And then this critical model that I have on the screen right here is your nursing process in combination with the critical thinking. So the critical thinking model used throughout our book provides one way of making sense of critical thinking. This model organizes critical thinking into 5 major categories. It's not meant to be an all-inclusive. We can use it as a guide when we are faced with clinical decisions or unfamiliar situations. It should help you to achieve good patient outcomes. It can be seen on page 34 in your book. We're talk about contextual awareness. So this is deciding what to observe and to consider, an awareness of what's happening in the total situation, including values, cultural issues, interprofessional relationships, and the environmental influences. And then we have questioning the focus. So what's going on in this situation? What factors may influence my behavior? What about the situation have I seen before, right? Drawing on past experiences. What emotional responses influence how I react? And then there's inquiry. So inquiry would be based on a credible source and applying the standard of good reasoning to thinking when you're analyzing a situation and evaluating your action. And then we have questions for focusing thinking. So how do I go about getting the information I need? What information should I use to organize my information? Do I have enough knowledge to decide what needs to be done? Have I used a valid and reliable source of information? Then we have considering alternatives. So we want to explore and imagine as many alternatives as we can think of for a situation. Questioning the focus of thinking. So questions for focusing thinking. What is one possible explanation for what is happening? Analyzing our assumptions. So we want to we're recognizing and analyzing our assumptions, making sure that the situation is appropriate. We want to examine our beliefs and make sure that they do not impact our choices. And questions for focusing that thinking would be which beliefs, values are shaping my assumptions, what rationale supports my assumption, what biases do I have that may affect my thinking and my decisions in the situation. And then reflectively, skeptically, and deciding what to do. We want to be questioning, analyzing, and reflecting on the rationale of our decisions. So some questions that can help us focus on that thinking would be what aspects of this situation require the most careful attention? Why is it important for me to intervene? Having decided what was wrong, what is the best response? And all of those kind of come at the phase of the nursing process, which we'll talk about that more in a little bit, and hopefully that'll all kind of make sense. So different kinds of nursing knowledge that goes into all of this. We have theoretical knowledge. So theoretical knowledge consists of information, facts, principles, goals, and evidence-based theories in nursing-related disciplines. It includes research findings and rationally constructed explanations of phenomenon. This is the type of knowledge you will use to describe your patients, understand their health status, rationalize which interventions you choose, and it allows you to predict patients' response to the interventions and treatments. We have practical knowledge, which is knowing what to do and how to do it. It consists of processes and procedures and is an aspect of nursing expertise. We have self-knowledge, which is used to think critically. You must be aware of your beliefs, values, and cultural religious biases. You can gain self-knowledge by developing personal awareness, by reflecting, which would be asking yourself, why did I do that? Or how did I come to think that? And then the final thing is our ethical knowledge. Ethical knowledge consists of information about moral principles and processes for making moral decisions. Ethical knowledge helps you to fulfill your ethical obligations to your patients as well as your colleagues. The book's key point here is practical knowledge, knowing what, that is knowing what to do and how to do it. And your theoretical knowledge is knowing why, that is knowing why we are doing something. So practical, knowing what, theoretical, knowing why. So moving on, our nursing process. Your nursing process is huge in nursing school. It is a systemic problem-solving process that guides all nursing action. It is the type of thinking and doing used in practice. In fact, the American Nurses Organization its standards of care around the nursing process. The nursing process, like nursing itself, involves both thinking and doing. Nurses must have good psychomotor and interpersonal skills, and they must use sound knowledge based on good judgment to use nursing process effectively. So your characteristics of your nursing process, we have the nursing process has all of these characteristics that I have listed here. It can be useful in many settings. The nurse will apply the nursing process to well and ill clients alike in many settings like homes, clinics, and hospitals. It's goal-directed and client-centered. The purpose of the nursing process is the patient gets patient-centered care. It involves both thinking and doing. Nurses must have good psychomotor and interprofessional skills, a sound knowledge base, and good judgment to use the nursing process effectively. It is not linear. One step does not rigidly follow the other. Instead, it's kind of a circle process that follows a logical progression. The evaluation step requires you to begin again using all the other steps. You will find that you go back and forth between steps, especially as we gain our nursing experience. It includes concurrent steps. In addition to being circular, some of the steps may occur at the same time. So for example, while inserting a urinary catheter, which would be considered an implementation, the nurse also observes that urine returns through the tube, which would be an assessment. And the next slide is the phases of the nursing process. So the nursing process has 6 phases or 6 steps. It starts with assessment, and then it goes into your analysis or diagnosis, your planning, outcomes, planning interventions, your implementation, and your evaluation. You can find this model on page 35 in your text. Note, however, that expert nurses organize the phases in different ways. Many have a 5-step process, combining outcomes and interventions into one planning phase. Some even have 4-step processes. And we're going to talk about the nursing process more now. So the mnemonic for this is ADPI. Right, so it's ADPI. IE. So it's assessment, diagnosis, planning, outcomes and interventions, implementations, and evaluations. And it is really, I cannot stress enough how important it is to know what each of these phases are. And the reason behind this is you, throughout your nursing school career, are going to have nursing questions, right? We have tests have questions. Questions are written for nurses, and they will cite a lot of times some part of the nursing process, right? So we'll be talking, and the question will ask you something about an intervention. And so often students will read the question, and rather than picking an intervention, they'll pick an assessment data, or they'll pick a diagnostic, or they'll pick an evaluation. So if you know what each one of these are, then it will be easier for you to answer those questions. So assessment is the first page, or the first phase, right? So this is gathering of data. Data is going to be subjective, it's going to be objective. We're going to talk way more about that in our next lecture when we're going through all of this. However, your nursing process always starts with assessment. The purpose is to gather the data so that you can start to draw conclusions about your patient's healthcare status. The next is your diagnosis. So you're going to identify the client's health needs. This is not a medical diagnosis, right? This is how your patient is responding. What is their healthcare needs, right? So if I have a fractured hip, my health needs might be, I need assistance with urinary elimination. I might need assistance with oxygenation. I might need pain management. My pain management may lead me to needing bowel management. So your diagnosis is also sometimes called your nursing concepts, right? You made everybody buy that nursing concept book, and you have bowel elimination as a concept. So do not get confused with all of that. If you need further clarification, talk to me about it. And of course, I'll be explaining this in class as well, and we'll talk more when we get to that chapter. So planning outcomes and planning interventions always needs to be done with your patient, right? Because you can have a dozen diagnoses, a dozen nursing diagnoses, or a dozen nursing concepts. And once you get all your concepts, you're going to want to start to do your outcomes and interventions. But you might think the best thing for your patient is to quit smoking. And you could do an entire conceptual care plan using the nursing process around quit smoking. And if your patient's outcome is not to quit smoking, but be able to run a 5-mile marathon, then you just did a lot of work for nothing, and the patient's not going to adhere to that care plan. Right? So your nursing process is what we use to develop our nursing care plans. So you need to make sure that you plan your outcomes and your interventions at the same time. And then we have our implementation. So the implementation is where you're going to be carrying out. These are going to be your actions. So this is going to be your doing phase, right? And then your evaluation phase is, did what you do meet, did what we do here meet the outcome we planned here, right? Or did all of the interventions we planned, were we able to implement them? Often students will come to the fore and they'll have a patient and they'll develop a huge plan of care of interventions and outcomes. And then the patient will go to a procedure and they're off the floor, and the student was only able to implement one of the interventions. So then when they're going to this evaluation phase and they're looking at their final judgment on whether their actions successfully treated their patient's problem, well, they might get not met, or, partially met, or unable to do. So we always want to follow within this step. And like it said, sometimes you might be doing an intervention and assessing them at the same time. But For the purposes of fundamentals and learning, we do it this way, right? We assess, we diagnose, we plan, we implement, and we evaluate. And as we're evaluating, we're also reassessing our patient to start over again. So going back, right, here we are back at this nursing process related to the critical thinking. This slide identifies the relationship between the nursing process and critical thinking. How is the nursing process related to it? Your key point, critical thinking and nursing process are interrelated but not identical. Nurses use critical thinking for decisions other than directed patient care. So decide how many nurses are needed to staff a unit, be an example. Some nursing activities do not always require reflective critical thinking. So applying a cardiac monitor, inserting a urinary catheter, they might involve it, but they might not. They might just be a skill. Nursing process is essential for problem solving. And then we go on to what is caring. So caring is always specific. We need to do it for each patient encounter. It's not abstract, right? That is that we don't just care for suffering humankind, but we need to respond compassionately to any patient's needs that they're having right now in the moment, even if we're busy or tired. Caring involves thinking and acting in a way that preserves the human dignity and humanity. It does not treat people as objects. For example, a caring nurse drapes a patient for privacy when inserting a urinary catheter. A caring nurse actions are never routine, and they're always personal. They're never impersonal. So some components of your caring, you need to be knowing, striving to understand what an event means to the life of a person. Examples would be illness, a new baby, the loss of a loved one. Being with is being emotionally present for the patient. So making eye contact, actively listening. Doing for is doing what the patient would do for himself if they were able to. So bathing, feeling, or calling the patient's pasture for them. Enabling is supporting the patient through coping with life changes and unfamiliar events, such as being in the hospital for the first time ever, or giving birth to a premature infant. We want to also be maintaining belief, having faith in the patient's ability to get through change or an event and to find fulfillment and meaning. Examples are adapting to a new colostomy, adapting to the loss of a limb, or going to cardiac rehab. Then we go into the full spectrum of nursing. So the definition of this is a unique blend of thinking, doing, and caring for the purpose of affecting good outcomes from a patient situation. So the model concepts, we have thinking, doing, caring, and patient situation. Nurses use critical thinking in all steps of the nursing process. They also apply critical thinking to the 4 kinds of nursing knowledge and what they are doing for their patient. So this is a visual representation of that full spectrum nursing model. We put thinking, doing, and caring into each patient situation or interaction, and we have these wonderful rainbow patient outcomes. So when we look at this model a little bit closer, we have critical thinking, which is your thinking, right? Thinking, which is your critical thinking, which enables you to fully use your knowledge and skills. And it also has theoretical knowledge, which are principles, facts, theories of what you have to think with. Right? And then we have caring. So caring is going to be self-knowledge and awareness of our values, beliefs, and biases. And then in that is also our ethical knowledge, which is understanding our obligations, our sense of right and wrong. Ethical knowledge, your sense of right and wrong. And then we have doing, which is our practical knowledge. So our skills, procedures, and processes. and our nursing process, which is our assessment and evaluation, everything you know about the patient, including contacts, planning and implementation, what you do for the patient. And then the last one is your patient situation, which is going to be patient data, physical, psychosocial, spiritual, and patient preference / contacts, contacts for care, environmental relationships, cultural resources, and support. And again, this is the model that your book uses, is the thinking, caring, and doing. So we'll have more examples of that as we go through. So this is one that you can read through on your own, right? It's a pleasant Saturday and you're meeting with an old friend whom you've not seen in 2 years. They said, I hear you decided to be a nurse. What made you choose that? How would you reply to that question? And you can work through that on your own. This is an example of this safe, effective care, the thinking, the doing, and the caring. So the term critical thinking seems to suggest that good thinking is intellectual activity rather than involving feeling of emotion. How do you think a nurse can use critical thinking to practice in a caring manner? And you would apply that to each one of these. Our Socratic reasoning, we have a patient which, as a patient, which safe, effective, caring competency would you choose for your nurse to have if a nurse could only be an expert in one of the skills? Would you want a nurse that was strong in knowledge? Would you want a nurse that was strong in skills? Or do you want a nurse that was just strong in caring? Again, that's something that you can think on your own, because so often students want to be the skills. They want to just do. And if you're the person lying in the bed being cared for, do you want somebody doing a whole bunch of skills that they know nothing about? And then do you want somebody doing a whole bunch of skills that's not caring at all? So interesting, provocative question. And that is the end of this lecture. So I hope you enjoyed it. If you have any questions, please reach out. Thank you.